Well, welcome everyone, and thank you for joining us for today's webinar. My name is Michael Power. I'm the editor of Supply Professional Magazine. Today we're presenting Evaluating Best Value in Healthcare Procurement, Stories from the Field. This webinar is brought to you by Bonfire. So just a quick bit of housekeeping before we get started. If you have any questions during the presentation, please type them into the question box in your GoToWebinar control panel. We will bring them up at the end of the discussion. Our moderator for today is Cam Davies of Bonfire. So without further ado, I'll now turn the presentation over to Cam.
Thank you very much, Michael, and welcome everyone to the webinar. Really excited to jump in today. We have some exciting panelists on the line and ready to contribute. But first, I'm going to set us up. I'm going to kind of lay the outline of today's agenda. So we're going to talk a little bit about best value procurement, or really balancing price, quality, reference, and everything to optimize the decision really for healthcare purchasing. Then we're going to introduce the panel, where we're going to have a lot of different good discussions around the nuances of best value procurement, as well as the technology gap in procurement specifically for healthcare. I will take just a moment towards the end to jump through a couple of features of Bonfire for healthcare. Likely those will come up during the panel, so these should help to put some images and visuals to some of the conversation that we're going to have. And then we're going to save panelist Q&A for the end. If there are questions that pop up during that would make sense to answer in flow, we may try to answer those as we go. However, we will definitely get to as many questions as we can towards the end of today. So to set things up, the first kind of topic is really trends in healthcare procurement. So as we talk today, the panelists know this, intimately, and really any customer of Bonfire, specifically in healthcare, understand the value of patient-focused outcomes. And that's really balancing, the price and technical considerations, and balancing those along with patient outcomes. Unique to healthcare is that patient outcome is really central, and we're trying to find the best value for the best money. When it comes to costs, there are rising direct and indirect costs of healthcare, and as the population ages, the pressures of that population increase on the healthcare system, and that puts a unique challenge on procurement professionals. While at the same time, for the past number of years, there's been increasing and tightening compliance requirements, meeting different CFTA rules, different vendor list rules, as well as a lot of different compliance nuances that our panelists today are well versed in. And that's also a key to the role of a healthcare buyer or a healthcare procurement team. So those are some of the nuances that we're going to jump into today. As a percentage of overall GDP spend, healthcare spending has been on the rise in Canada for the last number of decades. And as prospects for economic growth continue to improve, the population is going to continue to age, and we know that growth in healthcare spending will likely continue to grow well into the future. But that doesn't mean that there's tons of money to go around. We need to optimize those purchases. And that's really where best value or value-based procurement comes in. And it's really at its core ensuring that you get the best solution for your stakeholders at the best price, not necessarily the lowest price. Unique to healthcare, however, teams must facilitate decisions that balance best outcomes for patients and clinicians, and also balance taxpayer dollars, which is something in Canada that is front and center with healthcare purchasing. This means that evaluations often include price and non-price criteria. So there's a long list of different types of criteria that we often see in Bonfire, such as evaluating the service, support, and education for the products that are getting tendered or proposed, maintenance and total cost of ownership, logistics. There's other things like training, warranty, lots of other qualitative aspects in addition to the specs, the speeds and feeds of the different equipment or the services that we're evaluating. And often that gets split into different criteria and scoring mechanisms right within Bonfire. The other thing that we see quite a bit in Bonfire is the amount of different multiple stakeholder groups that come into projects, that come into competitive events. So we have obviously clinicians, we have physicians, nurses, managers of healthcare divisions or departments within the hospital or within healthcare teams. Administrators are coming in. We have facilities folks coming in on projects as well, not to mention finance and legal and procurement. Many times those individuals are also invited to in-person demos to really get a look, feel, touch, pick up, hold of healthcare equipment when we're doing equipment purchases or even service reviews where there's a demo involved. So when we combine all those different variables together, healthcare grows in complexity for these purchases, and we're still trying to optimize for patient outcomes. That is where procurement really plays the key role. Procurement is a key lever, and that's why we have some of the folks on the line today. They're a key lever in maximizing the value and ensuring those strong patient outcomes, but they're also playing a facilitator role, a subject matter expert in running compliant and complete projects for healthcare purchasing that match all the regulations and the compliance, and we're making sure that the projects are done on time in a timely and efficient way. That's where technology comes in. And oftentimes we hear from customers that are thinking about coming over to Bonfire, we have a bidding portal, and we use a bidding portal to go out and solicit. Sometimes that's the same bidding portal as the municipality that they're a part of. Sometimes that's a bidding portal that the province or the jurisdiction has suggested is used. And then on the other end, they may have some kind of ERP or some kind of procure to pay cataloging system, but right in the middle is where the RFP evaluation needs to happen. That's where all of those submissions are coming in. There's lots of different information from the vendors that satisfy all those qualitative requirements. And oftentimes that's still relegated to paper and Excel and PDFs and email. Really, this patchwork of a process leads to a really big administrative burden, often on the buyer themselves, and also an administrative burden on anyone that's scoring projects to review pages and pages of information and then try to use an Excel scorecard to score it. So I'm not going to take any more time before introducing our panelists, but today we're speaking with some healthcare procurement leaders who can speak directly to some of these experiences firsthand and what it's meant for them and their team. So joining us from St. Joseph's Health System Group Purchasing Organization, we have Janice Mount and Annette Senko. So welcome. And from Shared Services West, we have Rebecca Binns. So starting with Rebecca, welcome, and we're excited to have you as a panelist. Can you share with us a little bit about your role at SSW and maybe some of your history with Bonfire for the audience, Rebecca?
Yeah, for sure. Thank you. So I've been with Shared Services West since 2015 in the redevelopment space. And prior to engaging with Bonfire, as you have already alluded to, we used a lot of, administrative processes to facilitate the RFP evaluations, and as well as the receipts. So we definitely were buried in boxes and binders, and also, as you said, using the email and, flipping around lots of versions of Excel spreadsheets that, took a lot of time to prepare and may have had lots of different errors and so forth. So I was part of the initial team for evaluating and bringing the e-procurement to SSW back in 2017 when we started the process. And I was the initial pilot of the program, running all of the redevelopment procurements through e-tendering. We tried different systems, and definitely I became a big advocate for using Bonfire just based on, so much of the efficiencies and savings that we came up with and were able to measure through Bonfire. So I've been using Bonfire, I think, a year and a half now with much success.
Thank you, Rebecca. So Janice and Annette, are you able to chime in and share a little bit about the roles that you have at St. Joseph's and some of the history that you have with Bonfire now?
Hi, Cam, it's Annette. I'm the assistant director, and I'm actually responsible for the day-to-day operations as well as risk management. So I work very closely with our legal counsel, and that's very helpful to ensure that our processes are always up to date and compliant.
And good morning, everyone. I'm Janice Mount, a senior contract specialist that facilitates an RFP process to allow hospital members make good ethical purchasing decisions. I also help facilitate and implement new technologies that can help with the facilitation of best practices. These include collaboration tools such as SharePoint and Bonfire.
Wonderful. Thank you, Janice and Annette. A little bit of fun history. So St. Joseph's has been a customer with Bonfire for over 4 years, and much of the suggestions and feedback from St. Joseph's have been instrumental in how some of Bonfire's features and workflows have been built out for healthcare. And as Rebecca alluded to from Shared Services West, Rebecca, we're fortunate to have you on the line because you have been in the trenches with Bonfire and really helping prove out the business case and the value of Bonfire, even when another solution was suggested to be used. So I think a lot of good conversation should come of the panelists today, and I'm going to thank you again for joining. The first question that I'm going to pose out to the group, and maybe I'll start with Rebecca again, is how has sourcing software, i.e. Bonfire, been a force multiplier for your organization? How has it helped you achieve more within the organization?
Yeah, for sure. So when we first started the pilot, we had just come off of closing a large RFSQ, and we had our training room set up, which is like boxes and boxes, everywhere, and we were drowning in binders for sure. And we were going through the method of spending, probably an entire day just going through all those binders just to do those, compliance checks and so forth, making sure, everything was there, and then setting them up into, boxes to be sent off to evaluators and so forth. So there was at least a whole day that was spent. We documented that process, and we're able to add it into a business case, sort of the jumping off point. And then we went through the pilot, and partway through the pilot, we did a similar RFSQ, in e-procurement, and we were able to sort of cut all that time down and all that administrative. The mandatory compliance check probably took about an hour, I would say, excuse me, to go through all of the submissions, similar submissions. Like we had the side-by-sides for number of submissions received, types of responses and so forth, so we could compare apples to apples in that case. And through the pilot, what we were able to demonstrate is that within the first, 6 months of using Bonfire, I was able to double the number of projects that I was able to complete, and in shorter periods of time. And, with the efficiencies that we were gaining, I was just able to take on more work and still demonstrate, the savings and so forth, or even improve those metrics, as well as just having everything done in a shorter period of time because it was flowing through a centralized system. So certainly we've seen the value just in those metrics alone, which I know had freed me up to work on more strategic initiatives and less of the administrative. So I certainly became a lot more efficient. And then through that, we were able to sort of roll that out throughout our organization and provide the justification to move entirely over to the sourcing software solution with Bonfire.
Wonderful. Thank you, Rebecca. I'm going to resist the temptation to ask more about how you rolled it out, because we are going to jump into that towards the end of the conversation today. But I'm going to come back to that statement a little bit later. Janice and Annette, how about yourselves? How has Bonfire been a force multiplier for St. Joseph's Health System?
Bonfire has actually had quite a significant impact for our group as well. Before Bonfire, it used to take us several days or more to unpack and upload RFP proposals onto our website. And then each hospital would need to sort through all of the information to locate just the documents that pertain to them. And at times, 1,000 pages or more are received from each vendor. But now with Bonfire, we are easily able to disseminate the proposals so that hospitals can begin their evaluations right away after the RFP has closed. So this used to take us days and probably 6 or 7 members of our team, and it literally now takes minutes. So it's made a huge impact.
This is Janice. Implementing Bonfire really allowed us to share information to each team by using the multi-category decisions within Bonfire. This helped hospitals avoid sifting through information that was not relevant to them. So it really allowed us to eliminate hospitals or evaluators seeing information that didn't necessarily pertain to them.
If I can add as well, another thing that we found that really was a game changer was we had examples with the paper based where there had been perhaps like missing or incomplete COI forms, like those conflict of interest declarations, because of it being like a very manual process. There had been times that when we audited the dockets for our procurements that we would find missing COIs, and that became a big focus of our CEO herself to say we need to be better at this. Like we have to always have those COI declarations completed and reviewed. And with Bonfire, that was a game changer, that this is something that is just built right into the process. And I know that was part of, a major part of the justification for why we had to move forward.
Yeah, thanks for adding that, Rebecca, as well. And I think there was a couple different areas within Bonfire that we touched on that are really specifically built out for healthcare. Again, we can touch on this towards the end, but multi-category decisions where we can take multiple different decisions and split them out efficiently for St. Joseph Health System. And I know that Shared Services uses this as well as some of the automated conflict of interest. And I have a couple of screenshots towards the end that I'll flash up to kind of talk about some of those. Lots of themes came up so far, even in some of the panelist responses, and especially when we're prepping for this. But what we tried to do to make sense for all the attendees is split up the conversation into three primary buckets. So one is evaluation efficiency, and we've heard about that already, and we'll dig a little bit deeper. One is stakeholder engagement. We haven't dug super deep into this one yet, so we'll get a little bit deeper through the webinar. And then we've certainly heard about compliance, especially some of the risk management pieces and even the COI automation that you just brought up, Rebecca. So for those on the line in the audience, this is how we're going to structure the conversation today. To kick it off, I'm going to raise some statistics that Bonfire has published in our State of the RFP research report. When RFPs are getting built out, of course, there's qualitative criteria that have to be balanced with quantitative criteria. We did a research project with over 6,600 RFPs where we looked at the trends and we looked at how those projects were structured. These included not just healthcare, but also projects within cities and counties, school boards, and higher ed. And what that project kind of reported back was that on average, most RFPs have just shy of 10 criteria, and most have about 3 evaluation stages. Most of the time, that's a mandatory review, that's a technical review, and then a pricing review. However, we do know that healthcare differs quite a bit from this, and some of the projects that both of the organizations run have quite a bit more criteria and quite a few more evaluation stages. So perhaps back to St. Joseph's. Can you comment a little bit on some of the numbers on the screen and how some of your experiences differ from some of these metrics?
So we do use standard stages and evaluation groups. It really depends on the complexity of the project. One that's more detailed for more complex requirements and a more basic one for more routine purchases. Then the hospitals then decide on the weighting for each of the criteria as a group before the RFP is released. Or issued, sorry. So we do have one stage, like I mentioned, with complex requirements. It's a 5-stage evaluation process, and then the one with more basic requirements is a 3-stage evaluation process.
And compared with that, 9.6 criteria, does that seem similar to the projects that you're running, or are there more criteria for some of the projects that you're running?
No, we have about 10 different criterias for the more complex ones and about 4 for the minor projects that we run.
Okay, yeah, that makes a lot of sense. Rebecca, I know you run more of the infrastructure projects. So how would these metrics reflect some of the work that you're running?
Yeah, certainly very similar. When we're running the infrastructure, the construction projects, there's typically only about 2 or 3 criteria. But then, yes, when we're running, more complex procurements for some of the equipment or, capital or consumables and so forth, there's definitely, I would say, echoing what my colleagues at St. Joseph's are saying, about 10 or so different criteria that we're evaluating.
Mm-hmm. And for those that are newer to Bonfire, that evaluation stages is a way that you can split out it's typical to any RFP, but in Bonfire, you can split out and send only certain documents to certain evaluators. So when you're looking at balancing those qualitative types of information against the financials or against references, you can actually split and send only the relevant information to that stakeholder so that they can review and add their expertise. Question out to the group here, what's the value of being able to separate and send only by evaluation group? Can you comment on that value and how that's made evaluation a bit easier for your stakeholders?
Yeah, absolutely. It's Rebecca. I know for some of the equipment that we're procuring, and I'll let St. Joe's speak to a lot of this because I know you deal with this a lot, but it's certainly great for us to be able to isolate, let's say, the IT requirement of a larger technical specification that's being submitted, and just allow, those IT folks to isolate what they're responsible for, but also have view to, the larger technical submission. It really does help for them to just focus right in on what they need, rather than, as we said, flipping through binders and trying to find the information. I definitely have a lot of comments from evaluators now that if we set up the project appropriately in Bonfire so that we're requesting the information in separate sort of, not stages, but we request the information according to what we're asking to score. So the requested information section in Bonfire mirrors our evaluation criteria. So we have separate folders for, say, mandatory requirements, folders for technical, folders for IT, et cetera, and then everything's in the same place. It's really easy as well for vendors to just know, for the evaluators to know exactly where to go to find what they need and what's relevant to them.
Thank you. St. Joe's, do you have anything to add to that? I know you run some projects with pretty big evaluation groups up to 5 different stages.
Yeah, Cam, it's Annette, and that's absolutely correct. And in our process, hospitals always make their own purchasing decisions. So we really need to make their evaluation process as simple as possible. So being able to break down the criteria by category is invaluable. So the evaluators, so imagine this, we might have 12 or more hospitals buying 12 or more different types of equipment. And then on top of that, with 10 different types of criteria, the evaluators in the past, before we had Bonfire, they would get completely overwhelmed with all of the documents and trying to sort through and filter and find what they need. This makes it so much easier. We're able to just pinpoint exactly which documents go to which teams.
Great, thank you. So it's interesting, some of the statistics following that study that we did, the state of the RFP, and I think we'll do it again this year. We got some other statistics that were kind of interesting. That was the length of the average RFP submission, and keep in mind this is across public sector in general, so school boards, municipalities, and higher ed. The average submission length was about 121 pages, and it was, sorry, just trying to advance my screen here. It was on average about 4 submissions. So when you put those numbers together, that's almost 500 pages of submission documentation. There we go. About 500 pages of submission documentation, which really becomes quite a lot of information, especially when you're talking about binders. So when you're alluding to rooms full of bankers boxes and binders, we hear that from our customers across the board, not only in evaluating these projects, but also in the submission where vendors are literally bringing binders and binders to the front desk, all the way through to storing documents in a basement, or even storing contracts somewhere on site that they can store all that information. So quite a big difference, obviously, when you're digitizing something with a piece of software versus handling all that paper and having to duplicate and send out to the different evaluators. So, healthcare may differ a little bit from 121 pages and average of 4 submissions, but logistically, the difference in managing over time, paper versus online. Rebecca, you alluded to a little bit already, but can you comment a little bit more on just how these statistics, so about 121 pages and 4 submissions, what that was like with paper and how it's helped with Bonfire?
Yeah, for sure. I mean, right now, just sort of aside, but the health and safety team, they come around once a month to do checks, and I know they're much happier now when they come by my office and I'm not, at risk of having binders fall from, towers that we've stacked on top with boxes, because that was like a real thing that we used to have, just boxes everywhere, binders just, exploding out of boxes all the time, right? So they're definitely happier that we're not dealing with that, from that perspective. But certainly, it's just so much easier now, like when you have a close and I know my colleagues alluded to it as well, but it's just minutes now compared to, hours or days, and I've lived that life before of having to open those boxes, and we would always have to engage with we need a witness, right? Someone with the boxes. You'd have to sit in a room with somebody, two people opening and going through all those boxes and categorizing and flipping through the binders. You'd get your original copy and you'd flip through it and make sure it was complete. And then I would inevitably have, things that were missing, and, you're going through copies and do they match exactly? And it was a really cumbersome process that, we would do that completeness and compliance check, whereas now it's really just opening Bonfire, looking, is everything there? Yep, it is. And you're able to release to the evaluators, typically same day. You can go ahead and release, where in the past it would definitely take days. So I do echo that was a problem of the past that we don't have now.
St. Joseph's, some of the logistics of the projects that you're running are quite broad, as you alluded to, with all the different member hospitals. How did you manage that with paper before, and what does your world look like now?
Sure. So we actually have been using an online tool for a while prior to Bonfire. However, what we do is we issue one RFP with multiple decisions. We used to separate the submissions out and share the information with each hospital. We did use technology to facilitate this, but oftentimes the hospitals would print out all documents and distribute multiple copies of each of their internal teams. This really allowed for multiple versions of the same document over an organization. Bonfire really allows us to store the information in a central location to allow evaluators to only see the information they need. So before, it was online, but the hospitals would really have to see all the submissions. So even if it didn't pertain to them, they really had to sift through it and identify if it was relevant for them or not, which was very time consuming. Our projects are significant, as we do support over 400 member facilities in 5 different provinces. And out of our RFPs always include multiple participants and multiple equipment types. Bonfire has dramatically reduced the workload for our teams as well as our hospitals. The difference is actually quite astounding. We would never, ever go back to a manual process.
Powerful words. Thank you for sharing that. You alluded now to some of your evaluators and some of the ways that it's helped the evaluating of RFPs. Earlier in the conversation, a lot of the efficiencies for you and your teams. However, a key part of any RFP is getting engagement from not just your evaluators, but also your vendors and any administrative overhead or administrators that need to be involved. So I know respectively, both of your organizations have done things to develop some best practice to engage evaluators to ensure that evaluations are done both thoroughly, but also on time, which is a double challenge sometimes in healthcare when the priority of sitting at a desk and doing the evaluation might not be number one. Rebecca, since St. Joe's just answered, could you comment first on some of the best practices that you've started to use at SSW to get some engagement from your other stakeholders that are involved with RFPs?
Yeah, I mean, definitely we, during the, RFX development and we're engaging the evaluators, we certainly engage with them to sort of understand how evaluations would best work for them. And then we incorporate that into Bonfire. And then when we're releasing the submissions, the ability to sort of see where evaluators are are at in the process is certainly, you know, revolutionizing how we do it. As far as, you know, in the past, you would often show up to what we would, you know, call the consensus group scoring meeting, and you would often have evaluators who would not even crack the binder, right? Despite several, you know, reminder emails and so forth. Whereas now we're able to sort of say like, hi, you're, you know, you've logged in, but you haven't scored, or, oh, I see that you're 95% done, but you've missed maybe this one criteria. Maybe you didn't realize if you could go back in and finish it. And then, you know, we're showing up to those group meetings now, and they're way, way shorter than they used to be. So for sure in the past, you know, we'd have consensus scoring, which often would be, you know, an entire day spent just flipping through the binders and inputting scores and spending a lot of time talking about the different aspects of the proposal. Whereas now what's happening is we're getting all those scores completed, we're able to follow up, be proactive, and then at that group meeting, we're really just looking at the outliers, which was a change in practice for us that was very welcomed by, you know, SSW as well as, you know, our hospitals, where now it's consensus if you want, well, we don't call it consensus, excuse me, those group meetings now can be very quick. You know, sometimes we don't even have them in person. We just have a quick, you know, web meeting where I display the summary of results in Bonfire, and we just sort of agree like, hey, everyone's on the same page, your criteria, your comments are all here against all the criteria. You know, we're not going to spend a bunch of time, you know, arguing an agreement. We're just going to look at it, agree, and kind of move on. So certainly that has helped as well. One of the big things that's happened over the last year and a half here at SSW is that previously the administrators for the sourcing team were the ones that were responsible for sitting at the front at the tender counter, you know, doing all of that paperwork, get the bid receipts, and they were the ones that would sit with us and do the compliance, and they were the ones that used to collect those USB responses and then upload them into our system and then actually create those Excel documents, those Excel workbooks that we would push out to evaluators. And so they had to spend a lot of time like grabbing the different sections from every proposal, creating those side-by-side comparisons. And with Bonfire, what's happened is there's so little engagement from our administrators that they've actually been repurposed to other areas of the business where, you know, there's maybe a greater need. And so they're actually working on entirely different projects beyond what they used to do as far as bid administration and helping us with that. So that's been great as well, as far as, you know, how we're more efficient using Bonfire for evaluations.
Thank you for that. That was really interesting that you know, in a couple of ways you've said that there's more time for strategic work, which is really important when you're avoiding all that admin overhead and even repurposing whole staff members to different areas of the business. That's a good success story. St. Joe's, again, on the best practices in engaging with your evaluators and your vendors, are you able to share some of the ways that you've done that at your organization?
Hi, Cam, it's Annette. So we actually use both process and technology to engage our hospitals. So from a process perspective, we schedule regular touch points to keep our hospitals engaged throughout the process, such as like in activities such as weekly meetings, vendor fairs, and in-house trials. So that really helps. But what we found is that Bonfire makes it much easier to keep them engaged throughout, because it actually, as Rebecca has indicated, it's removed the burden of process and it gives them direct online access to the project. So, you know, we hadn't had the experience since I've been here with binders and hard copies. However, that cloud-based access is huge. It's been a significant advantage for us.
Hi, Kim, it's Janice. We also created a document for evaluators to use as a guideline for the evaluation process. We input that information directly into Bonfire. It merely complements the criteria and helps the evaluator understand their role, and it also helps to ensure consistency in the scoring. So we don't have as many calls as we used to in regards to consensus scoring. Most times hospitals are coming to consensus on their own.
Great, Thank you for sharing those best practices. And I think we're going to come back a little bit again to some of these, the nuances of some of the answers as we progress. To help us dig out some of the detail, I'm going to share again a couple of the stats from our State of the RFP report. The first one, which probably is no surprise to anyone that's run competitive events before with a deadline like this, up to 35% of all vendor submissions are happening within that last and final hour right before the deadline. So 4 o'clock on a Friday afternoon, if that's your deadline of 5 o'clock, that's when everyone's starting to get everything in. You know, and also not surprising is within the last day, you know, over half of the submissions are happening within that last business day, and certainly within the last few hours, almost all of them are coming in. Looking for, you know, do these stats make sense as well for healthcare, given that these stats were across all different public sectors? Is that your experience with receiving vendor submissions in terms of the crunch towards the end? Perhaps St. Joe's, you can comment on that first.
Yeah, so before an RFP closed, there was a lot of stress either because we hadn't seen a submission come in yet. And for those of you who don't know where we're located, we are actually on the 5th floor of a building with a very slow elevator. So if a vendor was in a parking lot 5 minutes before a closing time, chances are he or she was not going to make it. We've also heard of times of vendors racing on the highway to make it in. So again, not safe for anybody. Now it's quite simple. We wait for the closing time and we begin our evaluation. Oftentimes we can see that the vendor has started a submission. We can't see obviously what they've submitted, but we know they're in there working away. And again, we do see that vendors start their submissions towards the end of the closing time. I'm not sure what the rationale is about that, but we believe that in our office it's reduced the amount of stress, as well as reduces stress to the vendors as well, because it allows people to do their submissions as they complete information online. And it's also done in the comfort of their own office or home in a safe environment.
Great, yeah, thank you. And Rebecca, for SSW, does that all ring true to you as well?
Yeah, absolutely. And to kind of further on reducing stress in the office, I mean, we've had instances, as I think any, public procurement agent has also experienced, we've had instances where, people are coming in aggressively trying to get us to receive something after that closing deadline. We've had people crying in our offices, really difficult situations sometimes for those administrators who are sitting at the desk. A typical thing also in infrastructure, just sort of across that whole industry, when you're dealing with construction projects, it's very typical that the bid runners are collecting that last minute information and feverishly kind of writing it in like seriously the last few minutes before close. So, in times when we've closed construction projects, we've absolutely had, representatives from the vendors sitting in our lobbies, spilled out onto our hallways, using phones, spread out all over with documents that they're feverishly trying to write in, those last minute numbers, and then they're almost like fighting aggressively with each other to make sure that they're getting it in right, getting that timestamp back. So eliminating that has certainly been a lot easier, and I believe, I've received feedback from vendors that they absolutely do prefer, as we said, sitting in their own office or wherever they may be, and just uploading the documents in the 11th hour rather than sending a bid runner to sit in a lobby somewhere and try and fight with elevators or whatever it might be. Absolutely.
Mm-hmm. Well, I can certainly picture the scenario in my mind of both of those kind of combined: slow elevator, lobby, everyone spilled out. So very clear picture of kind of the before and the after. So thank you both.
Yeah, it's Annette. Can I just make one comment?
Please,
I just wanted to comment on Bonfire's technical support. In our experience, it's been second to none, and we've heard from more than one vendor, maybe even working over a long weekend or evenings, and they click the help button and they're easily and quickly able to get the support they need. And we've experienced that same level of customer service and support ourselves.
That's a great segue, and certainly so. We we tried to do our best to make sure that projects happen on time, and we don't put that burden on our customers, and we have a team ready and willing to help out. So I do appreciate you mentioning that. Thank you. In addition to the vendor experience, which was so clearly painted, I could feel the pain. We also have our evaluators, and I thought one of the most interesting insights out of the State of the RFP report was on when evaluators are scoring. And there's a non-trivial amount of evaluating that happens outside of business hours. I think the number is 27% of scoring happens outside of typical business hours. So that's after 7 p.m. and before 8 a.m. And so I'm curious to everyone on the panel here, your evaluators, and specifically with clinicians and those that maybe don't work a standard 8-hour business day, can you comment a little bit on how digitizing the process makes it easier for evaluators to take place in the process? And I'll let perhaps maybe St. Joe's start this one.
Sure. So Bonfire allows us to make document slots required and or optional. This really helps make sure that we get the information we need to make informed decisions. This also promotes fairness to each of the vendors, as this makes the expectation very clear.
So it's Annette as well, Cam. So yep. we actually do, we've heard lots of comments because Bonfire really requires very little to no training for clinical evaluators. And we have received a lot of positive comments that they appreciate not having to lug around binders. They can just easily open up an iPad, a portable device, when they're at the cottage, whatever, and complete their scoring. So it's really helped us to manage our timelines.
That's great. And I know, making sure that vendor submissions are both fully accurate and complete, as well as at evaluating, making it easier for evaluators, making sure that those are matched and easy to review is really important. And you certainly alluded to that as well, Annette. So Rebecca, I'll ask the question of you as well, but looking at some of these evaluator scoring patterns, and over a quarter of it is happening outside of business hours. Have you heard feedback from your evaluators of the difference in doing it digitally versus with paper?
Yeah, most definitely. And I think, too, one of the things, as far as having those paper-based submissions, and then, you lose a bit of control as the, bid administrator when you're sending them out into the world. And back when we had, the paper-based, we would always send them out and we would have those, confidentiality agreements signed and so forth. And one of the rules that we would try to enforce unsuccessfully a lot of the time was, that you're meant to keep the submissions in a locked, it's supposed to be technically a double locked room, you're supposed to have it in a locked office, in a locked cabinet, technically, but we know that's not practical. And we have had instances in the past where, evaluators have taken home the binder because exactly, who has time in a regular business day, and they've lost that. I've heard stories of it being left on public transit or, left somewhere. I took it to my kids' hockey practice and left it there, and that's a major confidentiality concern as well. So is having everything online and having control over the access, through a secured login is definitely making things a lot easier and more controlled, which is great. And I know definitely people do tend to work on these things off hours, so I'm sure they do appreciate, the ability to just sort of log in wherever and just, evaluate as they're able to.
You raised some really good points there about confidentiality and just having paper copies that could be easily left around. So thanks for contributing that story as well. Given that we have about 16 minutes left, I think I'm going to progress in now to the final section. I'm going to lend a little bit of light to some of the stats here, but I might just go right into the compliance conversation quickly before we round it with a bit of the Q&A. But really, the last stat that I wanted to share with you is that vendors really aren't the only ones that are evaluating last minute. In fact, evaluators are often coming in the final few days, the final 7 days. Over half are coming in to do their evaluations, which is not much of a surprise, I'm sure, to anyone. People tend to put things off until they absolutely have to get them done. So maybe quickly, to both the panelist organizations. Can you comment a little bit on how it's easier now to manage your evaluators and get them to score before the deadline and on time using some of these digital tools? And Rebecca, perhaps I'll start with you.
Yeah, I think I talked about it earlier. So one of the things that I really love about using Bonfire is that ability to see where the different evaluators are in their process. So you're able to sort of, keep tabs, if you will, and be able to remind people and gently nudge people about their, responsibilities to score before the deadlines. And I know Bonfire also sends, automatic reminders as we're getting closer to those dates. So it's definitely a lot easier. I do agree. You still tend to see people completing in that, final day or whatever it is, but it's definitely easier to control and say, if you haven't even started the scoring, then we'll just have to remove you as an evaluator. And that certainly prompts them, as opposed to having someone sitting in a room contributing and clearly going through the binder, in real time in front of you. So this definitely has helped.
St. Joe's, do these evaluation stats make sense to you? And have you seen these kind of the weighting towards evaluating right before the deadline as well?
Yes, we do. However, we do play with some of our evaluation by date in Bonfire, so we can move the date around to ensure that our evaluators are driving to their date deadlines. We've even had scenarios where, just showing the flexibility of Bonfire, we recently did a pharmacy automation equipment RFP where we hosted a vendor fair. In that vendor fair, we had hospital evaluators. They were able to kind of confirm what they had read in their RFP submissions and then go back and make adjustments to some of their scoring. And we had hospital representatives actually do that scoring or that adjustment of scoring right on site. So it really allowed them to drive to a deadline. They have a very tight deadline, so they were able to push their team to that deadline that was required for them.
That's interesting. So you built an in-person event into your evaluation process. So is that something that the evaluators did, or is that something that you organized as the bid admin?
Yeah, as the bid administrator, we organized that. It's just an opportunity for the hospital participants to see the equipment and ask questions that relate to the criteria that was built in the RFP.
That's great. Yeah, thank you for adding that example. To progress on, so the last section that we want to jump into here after we've talked about evaluation is really compliance. So in speaking with all of the panelists and leading up to this webinar, there was definitely a trend of more rigorous procurement and more rigorous compliance requirements and regulations of healthcare purchasing, and even the vendors that you're using and the vendor lists that you're using. So I'm hoping that perhaps, Rebecca, you could start here. What's at stake with compliance, and how has compliance affected your role as a procurement professional in healthcare?
Yeah, definitely. I mean, the compliance to the new, well, not so new anymore, but the trade agreements, it's been built into Bonfire. It helps us, building those timelines, as we've talked about, the COIs and having those built in, and one of the things now, with the government and the interim measure from the Ontario government, one of the things is utilizing those VORs, and we have a gap that we've identified with VORs in certain areas of hospital redevelopment where, I manage that portfolio. So we've sort of identified a number of areas that we want to target in the immediate future around creating VORs and hopefully sort of using those VORs for the benefit of the entire province for hospital redevelopment. And we're in a good place to be able to do that by using Bonfire. It's such an easy tool to use and to push out to evaluators from several different organizations. So we're in talks with some of our colleagues and different SSOs to collaborate in this process and hopefully have SSW lead a lot of those VORs on behalf of our affiliation so that we can use that, because we have that Bonfire tool and we have the established processes for the efficient evaluations and so forth, that we have all the tools and templates in place that'll allow us to be more in line with the government's current mandate to have all of these VORs in place.
And so St. Joe's, your role as a GPO, a large GPO in Canada, what's at stake for you, and what role do you play for compliance in some of the purchases and projects that you're running?
So absolutely true. The current legislation, BPS directive, CETA, CFDA, it does require a much greater degree of transparency and documentation than ever before. So in my mind, the worst case scenario would be to end up in front of the Canadian International Trade Tribunal because of a vendor dispute. In the past, believe it or not, vendors have been fairly reluctant to challenge hospital decisions, but we now know that this is no longer the case, especially when millions and millions of dollars are at stake. So Bonfire has really helped us to reduce this risk because it provides a simple mechanism for hospitals to complete their scoring and document all of their comments. And it also includes a detailed audit trail of all of the evaluator scores to justify their decision making. So that's been huge for us.
That's a great segue. Like the comments and the audit trail, I think, become really important. And the last set of stats that I'm going to share on today's webinar is some of the stats around consensus and even the pricing spread. So we know that 35% of evaluators score differed by 30% or greater. So that's an opportunity for discrepancy. And it could be just simply how an evaluator is logging in and scoring a proposal, or it could seriously be something that needs to be considered and a consensus needs to be reached. So, that tool within Bonfire and that mechanism of facilitating group conversation and group consensus is really critical when you have vendors that are coming back and protesting, as St. Joe's alluded to, as well as, just over a quarter of projects have a tight pricing spread of less than 20% between the highest and the lowest price. So that really points to a close race between vendors. So when a debrief occurs, buyers and those that are having to defend the decision have to provide adequate justification for why a decision was made, and having all of those comments and that audit trail easily accessible makes the job a heck of a lot easier. So being able to download that and have that kind of avoids what we've heard is hours of time. The last section I'm going to jump into here is change management. So to kind of close it out, both of the organizations on the line here and all three of the panelists have been, very heavily involved in using Bonfire and spreading it throughout the organization. We have some recommendations on the slide here that are garnered from all of our public sector customers in implementing change inside of larger organizations, and healthcare is no different. But usually we would recommend starting with something like a proof of concept. St. Joseph's has alluded to preparing both online and digital evaluations with in-person events and training. Rebecca has talked about tracking and reporting on metrics. And then also, St. Joe's, thank you for bringing up the support team and implementation. So kind of as the last panelist question of the day, maybe starting with Rebecca, how did you manage the change in your organization, and what did change look like from the paper process?
Yeah, so I think that with anything, I think those of us that were, early adopters, I became very enthusiastic, being part of that pilot, so there was definitely a lot of buzz that got started from those of us that were in the early stages, and that was a message that was being pushed out before we had even, rolled out Bonfire, was just how much, happier. There was a story that my boss had told me that when he was going to our senior leadership team for, the approval to implement Bonfire, one of the things he was able to sort of say to them was that, not only had my productivity gone up, but that he had noticed like a very significant sort of increase in my job satisfaction that he was tying directly to, Bonfire and using these tools, and again, allowing me to be more strategic. So there was that kind of early implementation and just sort of that buzz around your job's going to be better. You're gonna love it. Don't worry. And then rolling it out, there was definitely a lot of those kind of pain points, with some of the folks that might have been more resistant to change. However, one of the things we credit to the success absolutely was the commitment from Bonfire, the implementation process, the ability of the folks from Bonfire to like really get in, come on site from time to time, but really like walk us through the different processes and walk us through the procurements for like a long time, like months, and really just be available to users on call all the time, just answering questions and troubleshooting. That was definitely a key to this success with using Bonfire.
Thank you. Yeah, we're definitely proud of that team. They do great work. St. Joe's, as the final contribution for today, how did change happen in your organization? I know you alluded specifically to some of those in-person events, but can you walk us through a little bit of the change management that happened within St. Joe's?
Yeah, and as you can imagine, some members of our team were a little bit more enthusiastic about Bonfire than others. But for us, our main focus was on testing, and then more testing. Our projects are really large, high profile, and so we couldn't afford to make a mistake. And so there was all of the testing and then lots of communication and training. So before we went live with the real project, Janice did extensive testing. So she would run a project on Bonfire parallel to the traditional way that we were doing things. It was a fairly small project that we actually went live with, and we just had a few hospitals. And so we actually practiced with that, and then we were able to make any adjustments prior to using it on our next big diagnostic imaging equipment project, which had a lot more hospitals. Janice also developed training tools. She provided lots of communication and training materials for staff members and vendors. And she really embraced Bonfire right from day one, and then she led the way, and that really made a huge difference to our success.
We rolled out Bonfire really by RFP project. As Annette mentioned, we used a small project and then moved on to larger ones. What we did was we engaged key stakeholders as required, making sure that they were comfortable with the tool as we developed their RFP. During the Bonfire launch, we ensured I was always available to support our internal team, as well as external hospital members as well. Now that we've used Bonfire for a while, I can confidently say that their support team is definitely best in class. Whenever we have a situation or a problem we think we can't handle, we call Bonfire, we click the little button to ask for help, and within minutes we've got a response from Bonfire on how to solve our problem.
Yeah, I just wanted to add something else to that, because when we were going through and implementing Bonfire, sometimes a team member would have an immediate reaction to say, well, Bonfire can't accommodate this. There's a flaw in Bonfire. And what we worked out was typically 9 times out of 10, it was a process that we needed to take a look at internally. So we were very cautious about taking anything for further development until we reviewed exactly what the process should be, and going from there and making sure that everything that we were doing was actually best practice.
Thanks for that last little bit there on the implementation team and the support team. It obviously is a really important aspect of our service offering. And one of the things that we do offer for all new customers is an implementation specialist that can try to match your process. And specifically, Annette, to what you're just raising there, oftentimes it'll shed a light on where processes could be improved, even within our customer organizations. And that's an important part of implementation, because you can't just digitize something in a straight line. Oftentimes it takes a little bit of reinvention, and it's often a time to address some of the inefficiencies or ways that process could be improved upon without ruining any of the progress that has been made to date. Given that it's now 11:59, I'm going to have to progress through here towards the end. So I'm going to leave everyone on 2 points, and I'm going to skip a couple of these slides here. Everyone will get a copy of these slides, and there will be, I believe, a recording of the webinar available as well. There's been a lot of talk about Bonfire throughout, and I do encourage anyone that's interested to try it out, to request a demo and potentially even run a proof of concept with Bonfire to take a look at how your processes might be digitized. We were going to save some time for a Q&A, but the conversation actually answered many of the questions that came in throughout the Q&A today. There were a few more very specific questions that we're going to follow up with directly. So if yours did not get answered, we will follow up with you. So thank you for submitting it. And with that, Michael, I'm going to pass it back to you. But just before that, thank you very much to our panelists today, to Janice, Annette, and to Rebecca for joining and for your time and your anecdotes. We very much appreciated it. Michael, over to you now.
Well, thank you, Cam. And yes, I'd like to add my thanks to the participants for sharing their expertise today. And thank you to everybody for listening to the webinar today. As Cam mentioned, you'll be receiving a recording of today's presentation in your inbox in the next day or two. Feel free to reach out to me if you have any questions about that. With that concludes our webinar for today. Thanks again for listening, and please enjoy the rest of your day.